Hi, and welcome to Attentive Healthcare Solutions webinar, everything you need to know about NextGen ePrescribing. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. Before we dive into today's webinar, I wanted to take a moment to explain the process for the presentation. First, I'd like to mention this webinar will be recorded. We'll send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with Attentive, I wanted to share a bit of who we are with you. We specialize specifically in next-gen healthcare. We're passionate about providing solutions for healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen. And we also have some next-gen add-on productivity solutions, including ChartGuard and Refund Manager. Next, I wanted to mention an upcoming webinar that we'll be presenting a week from today. We'll be presenting on let me start that all over. We'll be presenting on interacting with patients in a new consumer-based healthcare arena. The concept of the ideal patient experience has long been debated in healthcare, and many still wonder, what is the ideal patient experience? Is it each individual encounter, or is it the sum of all interactions between the patient and the physician? How do we journey towards the ideal patient experience and still maintain a financially healthy practice? Join us next week as we explore how to survive in this new age of healthcare consumerism and how to best utilize your staff and tools available to you. I'll be sending out an invitation for that later today, or you can register now directly on the Events and Education page of our website. Okay, so back to today's webinar on everything that you need to know about ePrescribing and NextGen. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Manager of Client Development, and Lexi DeMarche is Manager of Consultant Development at Attentive. So Lindsay, the webinar is all yours. Feel free to get started when you're ready. And I'm so glad that you guys are doing most of the speaking today.
All right, thank you, Chelsea. So I'm actually going to be starting it off today. So I want to thank everyone for joining us today for our webinar. We're going to review everything that you need to know about NextGen ePrescribing. So before we jump into the ins and outs of ePrescribing, really those details, I just want to take a quick minute to explain why we decided to do this webinar and why we think that ePrescribing it's more important now than ever. So as we all are well aware, COVID-19 has really changed the way that providers are being able to meet with their patients and provide care. And according to a report from SureScripts, there's actually been an increase in ePrescribing, prescription price transparency, and also electronic case reporting. So this has all kind of come about as providers are really working hard to adapt to these new circumstances. So with more of an emphasis, on the need to ePrescribe, so that applies to both, non-controlled and controlled substances, really having the proper setup and using this process fully in the EHR has really come to light, how important that is in the past few months. So with that being said, let's jump into today's webinar. So we're going to start off by talking about really the building blocks of ePrescribing, and that is your configuration. So the majority of ePrescribing setup that we're going to see takes place in our provider master file. So we're going to see in the next few slides that a lot of the information that needs to be documented in order for your provider to be able to successfully ePrescribe takes place in that master file. We'll also take a look at a practice preference that may save some of your users some time when they're actually ePrescribing. I did want to mention just before we go ahead and jump into all the details that this slide deck will be sent out after this webinar. So don't worry if you're not getting down every single step that I'm mentioning. You'll have these slides to review with the screenshots. So once you actually go to check your configuration or configure a new provider, you'll have those in front of you. Okay, so now let's look at the first step in configuring the provider master file. So that takes place on our demographics tab. So there's a few pieces of required information that you need to capture for your provider. The first is the last name and the first name. So that sounds kind of self-explanatory, but one thing I did want to make sure to point out is that it's important that this first and last name listed here is the provider's legal name. So we don't want to put any nicknames here. We don't want to put any suffixes. For example, we don't want the last name in MD, because that can just cause issues when they are trying to ePrescribe. The second item that we would set up here is the full address. So that needs to include things like the street name, the city, the state, and then finally that zip code. You do also want to make sure that if the address that you're putting in here, for instance, your practice address, does include a suite number, you want to make sure that's included. So again, kind of like the name, it's just to make sure there's no issues when they are sending prescriptions electronically. Finally, on this tab, we want to make sure that there is an up-to-date phone number, fax number, and email address for this provider. So again, this is all just to make sure that everything goes smoothly when they try to ePrescribe. The next item that you'll want to review to make sure that it's in place, it takes place on the System tab, and that is the provider's NPI. So you want to make sure that is there and that is accurate. So in addition to that NPI, on our practice tab of the provider master file, you want to make sure that the DEA number is there. So I will note that that DEA number is not required if they are just prescribing non-controlled substances. We will get into controlled substances a little bit later. But if you are going to enter that DEA number, I wanted to point out that if a prescriber does not have an individual DEA number, so maybe they're a physician assistant or like a nurse practitioner, they actually do have the ability to use a supervising provider's DEA number. And the way you would just differentiate that so it's not duplicated in your master file is you would actually just add a unique suffix to the end. So for example, you could use that supervising provider's complete DEA number and then add 1234 onto the end. So that's one way that you can get around that for non-controlled substances. On our EHR tab of our provider master file, we need to make sure that the prescription pad address is correct on this tab. So this is the address that's actually going to be sent along with that electronic prescription through SureScripts. So this can be copied from any of those addresses on the demographics tab. So you can use any of those business or other addresses, or this can also be the practice address. So and along with that phone number and fax number, if you do want this to be different than the demographics address, potentially you want questions about prescriptions, they have a dedicated phone line. You can put that here. So you have that option on the EHR tab. And then the final tab in our provider master file configuration, as you kind of probably assume by the name, is the ePrescribing tab. So really making sure that this tab, probably more than any of the others, is really crucial because this is where we're actually going to set up what functionality the provider is going to have, as well as make sure they're enrolled. So our ePrescribing tab has a few sections. At the top, this is where we're going to actually select the SureScripts, what they call service levels, that this provider is going to be using, and then also enroll the provider. So in my opinion, these two sections are a little flipped. You do want to start off on the right-hand side by checking off all of those service levels that the provider will be using. So you can check off those for retail prescriptions as well as mail order. So again, just any of those that they'll be using, you check those off. And then the next step would be to use the left-hand side. And this is where you're actually going to enroll the provider in both that retail and that mail order networks. And you can do that by clicking that menu button and then selecting enroll for one or both of those options. I did want to point out that the enrollment here is practice specific. So if you do have multiple practices within your organization that the provider could potentially be e-prescribing from, you do want to make sure that is set up for each practice. And if you aren't familiar with the service levels that I've just been describing and kind of lost you there, don't worry, we're about to go into depth into all these options and some of their uses. So in addition to enrolling the provider on this tab in those top two sections, we also have the ability here to set if a supervising physician is required. So there's a checkbox for that on this screen, and then you can actually note who that supervising physician should be. And then finally, we have a section on this tab, and that will allow us to set up tasking for ePrescribing. So we can note different work groups and then also categories if you choose to do that. And those can be set up for our ERX refills, our ERX errors, any RX change requests, and then also for EPA, which is that electronic prior authorizations. So we can set up these work groups so that way not only the prescriber is receiving tasks, but also any other users who potentially would help the prescriber with managing those tasks. And then the last step to configuring ePrescribing for your providers is actually something that's optional. So it can just help with saving some time. It's actually a practice preference. And this setting is going to allow users to send medications to multiple destinations at once. So let's say, for example, that you have a patient that is having several medications prescribed, and some need to go to a retail pharmacy. However, there's a different medication that needs to be mail order. So if you have this option enabled, when that prescriber actually selects those multiple medications and clicks send, they can actually choose the destination for each medication from this one screen. So this is really going to save that prescriber a lot of time. They don't have to go through and select each medication separately and note a different destination. So in addition to configuring those providers to ePrescribe, we're really finding that more and more practices are needing to set up ePrescribing of controlled substances as well. So we're going to go into detail a little bit later on, why that is. It has to do with some regulatory deadlines that are coming up. But we're really seeing that more and more states are requiring ePrescribing with controlled substances, and some of those deadlines are really quickly approaching. So with that in mind, we're going to take a look at some of those additional steps on top of what we just saw if your prescribers are going to be using ePCS. So our setup for ePCS, there are a few steps that take place in the provider master file, and then the majority of the configuration outside of that master file does take place in System Administrator. So now let's take a look at some of these options. So our first required step in that provider master file is on our practice tab. So here we need to make sure that we are entering a valid DEA number for this provider. So it's important that I point out that unlike we just saw with our ePrescribing of non-controlled substances, this was optional, and we could also set up, share kind of that DEA number if, for instance, like a physician assistant didn't have their own. In this case, ePCS does require that the prescriber use their own DEA number. So that it is important to make sure that this functions correctly. The other tab in this provider master file that we need to address is, again, that ePrescribing tab. So here, we're going to want to make sure, like we were just discussing with those checking off those service levels, that the ePCS service level is checked off. You will notice that this is only available for our retail prescriptions. So just keep that in mind when you are enrolling your providers. Once you've checked off that ePCS service level, you will want to make sure that you are updating the enrollment for that retail network. So again, on that left-hand side, you can click that menu button and then select Update. So that's important anytime you make a change to a service level, that you are going ahead and updating that enrollment so it actually takes place, and then they're able to use that feature. So once we've completed all of those updates to the provider master file that we just discussed, the next step is to set up all the required information in System Administrator. So before we're going to enroll each individual provider, you do want to make sure that your authentication method is set up. So we're going to start with making sure here that our provider relationship is set to self. So again, each provider who is going to use ePCS needs to have an assigned provider and then also that relationship of self. So then that next step is to turn on that authentication method. So in Universal Preferences in System Admin, you'll find a folder for ePrescribing, and we'll want to double click on that ePCS authentication method. So then you'll enter in that, for that value, the type of method that you're going to be using. So there's a few options that are available with NextGen for that two-factor authentication. And you can see them listed here. So again, this is something you'll have the slides you can reference back to if you are new to ePCS and plan on setting this up. You'll want to make sure essentially here you're just telling NextGen, this is the token method that I'm choosing to use. So after you have enabled that two-factor authentication and made sure that provider has a relationship of self, we're actually going to go ahead and register the provider for ePCS by clicking on the ePCS button on their user profile. The first step to setting up that prescriber is to enable them as what we call a registrar. So this is done on our registrar tab of our authentication and authorization window. So you would check off that box, and then that will allow them to act as a registrar. We'll save those changes on this tab when we return to the user profile by clicking Update. The next step is to set up that two-factor authentication credentials. So after we've told NextGen which system we're going to be using, we'll actually need to set up that for each individual prescriber. So this will be done on the Credentials tab of this window. And the exact screens that you see may vary. So what we have in this example is the semantic VIP token. So that is one brand that can be used. If you use different brands, such as maybe like Imprivata, your screens might look a little different, but it's kind of the same process. So in this example, to add my VIP token information, I would click Add. I'll be asked to enter my NextGen password. And then on the next screen, I'll be asked to verify my token information. So in this example, I need to enter my security key and my 2 codes. I would then click Activate, and then that is going to activate the two-factor authentication that I plan on using. And then the final step in this ePCS configuration is to actually grant that provider access to be able to ePrescribe the controlled substances. So this step does require both a Registrar A and a Registrar B. And we've learned from some practices that we've worked with that who these registrars are can be a point of confusion. So I just wanted to clarify some of the requirements. So our Registrar A, they only need to have a NextGen username and password. So they don't have to have their own DEA number. They don't have to have the two-factor authentication. So this can be a prescriber, it is in some cases, but it doesn't have to be. So it can be any administrator, really any user in your system, as long as they have a NextGen username and password. So I really think that, in my opinion, utilizing someone other than a prescriber is really going to eliminate the need to tie up 2 providers for this process. Our Registrar B, however, does have to have a valid DEA number and those two-factor authentication credentials. So this Registrar B, they can be the prescriber who's being enrolled, but it doesn't necessarily have to be. So any prescriber that's set up in the system can be, take the role of Registrar B. So, I think this can really help if you set up additional Registrar Bs, so as many, prescribers as you would like. And then, you can really help when you're trying to schedule time to enroll new providers instead of just having to work around, that one particular provider schedule. So once you've established who those registrars are going to be for your practice, you'll complete that final step on the Access tab. So our Registrar A is going to need to click the authentication button next to Registrar A on the screen. And again, they just need to have their NextGen username and password. And then once that's complete, Registrar B is going to click on the second Authenticate button, and they're going to enter first their NextGen password, and then that'll be followed by their two-factor authentication token. So once those steps are complete, that ePCS access for the provider is now updated. It'll show as granted, and that configuration is complete. So now that we've reviewed some of those steps required to get your providers ready to electronically send those prescriptions, let's take a look at some of the many options that are available when sending medications. So as we kind of briefly touched on in the provider master file, SureScripts offers a number of what they refer to as service levels. So these service levels can, when they're activated, help you unlock different features that the prescribers can use when they're ePrescribing. So just keep in mind when we're talking about the setup of these different service levels, that the prescriber does need to be enrolled in each service level separately. So the first service level that we see here is New RX. So this is the default service level. So all providers, when they're enrolled, automatically have this turned on. In addition, we also have the ability to receive refill requests, view medication history, check patient's eligibility, review RX change messages, review RX fill statuses, use cancel RX to send those cancellation requests, ePrescribe controlled substances, and then finally use electronic prior authorizations. So again, I know I just kind of quickly went through what those service levels were, so you'll have these slides. You can always come back and reference if you're unfamiliar with any of these service levels. So before we dive into each of those service levels and all their functionality, as I promised, I did just want to mention that in order to utilize any of these services, not only does the prescriber need to be enrolled, but also the pharmacy that they're communicating with. So if you're wondering if individual pharmacies that your prescribers typically work with are actually enrolled in using any of these services, kind of a quick way to check that is to go into the pharmacy's master file and go to that ePrescribing tab. So I did just want to point out it does require that your pharmacies in your system are mapped to those ePrescribing pharmacies. Okay, so now that we've reviewed how the service level enrollment actually works, let's take a look at one of the first options, which is refill requests. So refill requests can actually be sent from pharmacies where prescriptions have been sent by the provider. When a prescriber receives a refill request, that request will be visible as a task. So we'll see that in the workflow module, as well as in the medication module, what we call our manage refills window. Once that request has been responded to, so either that prescriber approved or denied it, that response is sent back to the pharmacy, and that notification is added to the patient's chart. So you can always go back and review those notifications. So there are really two main types of refill requests that a prescriber might receive. So the first is matched. So these refill requests, they were able to be matched to an existing patient with that medication and prescription in your database. So once those are received, the prescriber can either approve or deny those requests. However, if any of that information coming from the pharmacy in the request is not found in your system, then a task will be created separately for that unmatched request. So basically, it's typically unable to be matched because of the patient, the medication, or the prescription isn't able to be found. So when those unmatched refills are received, as I mentioned, they're going to create that task in the inbox of, depending on your setup, the prescriber, but potentially also prescribers' work groups. So when you open this task, you'll get the refill request matching window. This window is actually going to allow you to manually match things like patient demographics, medications, and prescriptions. So if you are able to match that information to what's in your system, then you can go ahead and approve that request and send it back to the pharmacy. There are also options on this screen, however, to deny requests. So for example, if you don't recognize a patient, you can deny it for unknown patient. Or there's also a list of other reasons. For example, like if an appointment is needed before you approve that refill request. Our next service level that we're going to look at is our medication history. So this feature is actually going to allow you to view the history of a patient's prescribed and dispensed medications. So that historical information, depending on your version, is pulled from the PBM claims data and also the pharmacy fill data. So as I just mentioned, it does depend on your version because the ability to see fill data was added in 592.842. So if you are in a previous version, you would only be able to see claims data. So there are a few steps that need to be completed for each patient in order to use this feature. The first is running the RX eligibility, which we'll touch on a little bit in a second, for that patient. So this is required if you want to see that claims data, but is not required for that fill data. But in order to see the full picture, you do want to run that RX eligibility. And then secondly, because this data is coming from potentially databases outside of your practice, it does require a consent. So we can find that form to note that consent was received from the patient. When we have that medication module open, we would go to our tools menu and then choose medication history consent. So once that patient has consented, a user can actually click on the medication history button. We'll find that in our medication module on the toolbar, and that's going to open up our prescription history viewer. So again, if you are using version 592 or higher, you will be able to see under that source column both pharmacy and claim, and you can use that sort feature in the top right to sort the data that you're seeing. In addition to just viewing that data, you also have the ability to actually import those medications directly into your system. So there's a button that allows you to go through the clinical reconciliation process. So you would go through, you can choose to add, ignore, or replace individual medications. So that way you're only bringing in what you need and not any unwanted data. So I've seen this feature, that reconciliation especially used firsthand, with a practice that was brand new to NextGen, and it saved their users so much time instead of having to manually add those medications for every single patient that comes through the door. So another beneficial service that's available from SureScripts is the ability to verify patients' prescription eligibility. So this data is actually supplied from what's called a pharmacy benefit manager, or PBM, and you can retrieve this data once every 24 hours. So there are quite a few ways that your practice can choose to check eligibility for your patients. So it just kind of depends on your setup and your needs. So the first is to automatically check the eligibility whenever a new encounter is created. So it's really going to eliminate that manual process, and save some time. So that option is configured in Universal Preferences and System Admin. The next option is also automatic, but it will actually wait to check eligibility until that medications module is open. So, again, this is still an automatic process, but it will, save your users from having to manually check that eligibility if there's ever a time they're looking at it, outside of a newly created encounter. So this setting is also turned on in our universal preferences. The eligibility can also be checked manually at any time. So that takes place in both the workflow module and the medication module. So let's take a look at how some of these manual options work. So on our Appointments tab of the Workflow module, that eligibility can be checked for individual patients as needed, if you don't have one of those automatic processes in place. So to perform a check, the user would just find that patient's appointment in the list. They would right-click on the appointment and select Check Eligibility. If that check was successfully sent, the user is going to see a confirmation message letting them know. We also will see that we have the ability to check this in our workflow module in a batch. So if we want to look for all patients that are scheduled for an appointment for the current day, we can do so. So this option, while still being manual, it's obviously going to save a little bit of time instead of having to run it for individual patients. So to actually send that batch eligibility, you would go to that Appointments tab and you would select that gear in the top left. We would choose our Batch RX Eligibility option. And again, if that check was performed without any issues, the user will see that confirmation message. And then, as I mentioned, our final option for manually checking that RX eligibility is found directly in our Medications module. So when we have the module open on the top right of the grid, you'll notice an eligibility button. So if the status reads no eligibility status, then that button can be clicked and it's going to manually perform that check right then. So in addition, this button can also show some additional statuses. So you can see, like in our example here, status of pending, which basically just lets me know the application is still working on getting that information. And then once that data is returned, we can see several statuses like the patient's eligible or if they're not eligible. So just keep in mind that if any of these last three statuses are showing, the eligibility can't be checked again, even manually, because you do have to wait till that 24-hour period is over. Another service offering from SureScripts is the ability to receive what they call RX change requests. So these requests do come from the pharmacy directly, and the messages will either be sent to that prescriber or also the work group if you've set that up, and they'll receive those in the form of a task in their inbox. So these requests to change the prescription, they can either be approved, but they're going to make some changes, or denied. So if a modified prescription is approved, that new prescription is going to be added to the active list of the medication module, and the old prescription will automatically be moved to inactive. So you can see in this sample message, a substitution is being requested from the pharmacy to use a generic medication instead of the brand name that was originally sent. So there are three main categories of RX change messages that the prescriber may receive from the pharmacy. So the first is what we call generic substitution. And this message would be received if a brand name medication is prescribed, but there is an alternative for a generic option. So in this message, the prescriber is going to be given a list of suggested generic medications, and they can choose one from the list. The prescriber does also have the choice to deny the request, and then it will keep the brand name prescription as is. Another possible message type that can be received is if a prior authorization is needed for insurance. So the prescriber is going to have the ability to document that prior authorization ID and the effective date. That'll be directly in the message, and then that can be sent back to the pharmacy. So the prescriber will also have the option to deny the request. So that can be for a few reasons, like if that prior authorization was denied, or if the payer was not contacted. And the final message type that might be seen is for what's called therapeutic interchange. So these changes are recommended by the pharmacy for several reasons, things like patient safety, to help with keeping down the patient's cost, or even to help with patient compliance of actually taking that medication. So some examples of those suggested changes from the pharmacy can be things like a drug interaction alert that the pharmacy is seeing on their end. If they would like for you to switch to a formulary preferred medication, they may request to change the number of days supplied. For example, 90 days versus 30. Optimizing that daily dose, and then finally clarifying that script. So to make sure the right information is being given to the patient. So each of these are exchange requests. They're just suggestions to kind of benefit the patient. So with all these options, you do have the ability as a prescriber to deny any of those requests, and it will keep that original prescription. So in addition to pharmacies having the ability to be able to request changes to prescriptions, another SureScripts service level is going to allow you to have some more transparency into the filling process. So that RX fill status is returned directly to the medication module from those pharmacies that are participating. If individual users do want to see this information, they do need to update their grid preferences in the medication module. So you can see on the screen some of the options of statuses that could be returned. So, for example, was the medication ever dispensed? Was it dispensed but only partially? Not participating, so that's going to allow you to see that the pharmacy is not participating in the service, so you're not sitting there expecting a response. So in addition to those fill statuses in the medication grid, we can also see additional details about that dispensing information. We can do that by right-clicking on any medication, and we would select the RX fill history. Another time-saving service that's provided by SureScripts is called Cancel RX. So this service allows prescribers to send cancellation messages to pharmacies for the previously sent prescriptions. So this actually happens automatically if they're enrolled when that stop button is used. I did want to point out that it doesn't matter who the prescribing provider is. As long as they're enrolled and use that stop button, the message will be sent. This does, just like all the other service levels we have seen, require that the pharmacy is participating as well. So if the pharmacy is not participating, the user would see a message of that, so they know that you still have to go through your normal process of canceling, if you need to call the pharmacy, for example. If the pharmacy is participating, however, once they receive that request, they can respond back and let you know that if the request was approved, and also if the medication was dispensed at all. Users can track that status of that canceled prescription in a few places in the EHR. So one of those is by using that ERX status window. So here they can sort those results by whether that cancellation request was sent, and then also if any responses have been returned. Users can also view that cancellation request status directly in the medication module. So this information is found under the dispense history link. We can see that at the bottom of our medication details. So SureScripts also offers a service level that I mentioned before is becoming more and more important. So that's the ability to electronically prescribe controlled substances. So we already kind of reviewed these requirements that must be met for some of that setup. So you can refer back to those slides at the beginning if you had any questions about this. So ePrescribed controlled substances, they're sent from our medications module, just like the rest of our prescriptions. I did want to point out that something that can trip up some users is if when that medication was being created, that prescribed elsewhere box was checked, you won't be able to send this controlled substance. So just keep that in mind. However, if it is unchecked and the user has been properly set up for ePCS, they can click send. They'd verify the prescription information, select the pharmacy, and then on the bottom half of the screen, they're going to enter their NextGen password, and then also whatever that token method they're using for that two-factor authentication. Once all that information is entered and correct, they can go ahead and click send. The final SureScript service that I want to review today is the ability to request prior authorizations electronically. So there is some configuration, like we've seen with a lot of our service levels, that does need to take place before this can be used. So besides the obvious of adding that service level to our appropriate providers, we do also need to enable this feature in universal preferences. In addition, you also want to ensure that users who are going to be using this feature have the appropriate rights set up in System Admin. So there are two separate rights. So one is to allow access to manage EPA, and the other is to actually initiate those requests. So requests for those prior authorizations, as well as the management of those requests, both are handled in our medication module. So to request a prior authorization for a medication, the user is going to locate that medication in the grid, and then next to the accept button, they'll see a link to initiate EPA. I did want to point out that there's a few reasons why that link might be grayed out. So the first is the user doesn't have the right permissions set up. The second is if the prescriber of that medication isn't enrolled in that service level. And then another reason that can trip some users up is if that medication is still in temporary status. So until we click accept, we're not going to be able to initiate that request. Once that request has been sent, we can view the status of that request at any time. And again, that takes place in the medication module. So this does require that the user who wants to see this information has the prior auth status column added. So that can be added in grid preferences. So once the EPA requests have been sent for a patient, the status details, along with any outstanding tasks that may have come from the PBM, can all be managed in the Manage EPA button. We find that in our medication module toolbar. So this Manage EPA window is where users can work any tasks that were sent back by the PBM. For example, they sent back questions that need clarification. And they can also use this window to appeal if a prior auth request was denied. So to make those electronic prior auth responses even easier, to track and manage, you do have the ability to set up tasking. So if you remember, we mentioned in the provider master file on that ePrescribing tab, you can set up both a work group and a category if you choose to do so for EPA. And that's just going to help with managing those tasks. And you can see, when something's been approved or if action is required for that request. So as you can see, there are really a wide range of SureScript service levels. They can really help your providers be more efficient and also provide better care to your patients. I do have one final SureScripts feature. It's not technically a service level, so that's why I made its own section, but I think it's really helpful nonetheless. So that feature is called real-time prescription benefits. So this functionality was introduced in 592.842. And this feature is going to allow the users to view the estimated cost of a prescribed medication. And that's going to be based on that individual patient's specific formulary and benefit coverage. So this allows providers to see the estimated patient cost and also make decisions real time to see if there's a way to lower that cost. There are two pieces of configuration that need to be done before this feature can be used. So their first feature is in Universal Preferences to enable the option. This is turned on by default, when you do upgrade, but just doesn't hurt to go in and verify that it is turned on. The second is for each user who will be using this feature. They will need to make sure that on the formulary tab, that real-time prescription benefits is checked off. So again, it's checked off by default when you upgrade, but doesn't hurt to just verify. So as you can see from this list, there are a few conditions that must be met for each individual patient before this feature is going to be able to give you all of its functionality. So the first is that configuration I just mentioned. So that universal preference and that user preference are enabled. The second is that RX eligibility was run. So this is required in order to have the information needed to make these cost estimations. The patient also has to have active coverage through a PBM, and that PBM needs to participate in this feature. So all of that is just to make sure that we have the information supplied that we need in order to see the information. So with all those pieces in place, the real-time prescription benefits can be checked for your patient. So we'll see this information in our medication module on our medication details. The first section that we'll see is the estimated patient cost. So that is only going to be displayed when that initial response is returned. So this is real-time in the moment information, so it will not be saved to the chart. As you can see in this example, it's grayed out. This is a previously prescribed medication. That cost will update, as if you change to choose any alternatives. And then, as I mentioned, it will clear when that medication is actually saved. The second section that we'll see is a link that's going to allow us to see alternative medications and pricing coverage. So this is again going to be specific to that patient based on their PBM coverage and the pharmacy selected. And then finally, there's a drop-down that lists all the patient's preferred pharmacies. So that can be used to change the pharmacy and potentially find a better deal for that prescription at a different pharmacy. So you can see that utilizing all this information can really help with being upfront about the cost information with the patients and potentially even saving them money. So now that we've covered all of the configuration and then several of the tools that are available when you're ePrescribing, I'm going to turn over the webinar to Lindsay, and she's going to explain some of the regulatory updates that are important to know.
Great, thank you, Lexi. So like Lexi mentioned, I just want to go over the current regulatory landscape surrounding ePrescribing because there are actually a lot of changes and deadlines coming, which is another reason why we picked this topic today. So first and foremost, let's start with the big one. Beginning January 1st of 2021, in a few short months somehow, providers in the United States must use electronic prescribing software when prescribing controlled substances containing opiates for Medicare patients. Once this mandate takes effect, only electronic prescribing for controlled substances, or ePCS, what we've been referring to, will be permitted. So this federal mandate was a result of the effectiveness of this ePCS in curbing fraud in many of the individual states who passed their own mandates previously. New York was actually the first to mandate this in 2016, and a lot of others quickly followed. So you can see this based on the states listed on the screen with that state mandated ePCS required date listed in parentheses after it. I want you to focus on the amount of dark blue that pops out here. These states are the ones that have mandates that will take effect next year in 2021. Any state that's not listed on here, either they do not require ePCS mandated by the state right now, or there is pending legislation right now. Now, if you're a more visual person like myself, here's a map showing kind of the exact same information. Again, based on the key, any state in that light blue, or I guess we'll call it a more matte blue, not sure how I want to describe it, those are all 2021 effective dates. So besides e-prescribing controlled substances, the use of prescription drug monitoring programs, or PDMPs, are becoming more prevalent and required by states. So a prescription drug monitoring program, or a PDMP, it's actually an electronic database that tracks controlled substance prescriptions in a state. So PDMPs are tools for healthcare providers to see patients' prescribing histories to inform their prescribing decisions. However, obviously a PDMP is only useful to healthcare providers if they check the system before prescribing. So some states have implemented policies that actually require providers to check their state PDMP prior to prescribing certain controlled substances. Now, if some of you are thinking, I've never heard of this before, my state definitely doesn't have this, you may be surprised. Usually your state PDMP is your state name followed by PMP or PDMP. Like Minnesota is just Minnesota PMP, or Alabama is Alabama PDMP. However, there are some unique ones that I listed on the slide, such as, California is actually called Cures. I've had some clients, in Maryland, it's called CRISP, or Michigan, it's called MAPS. Ohio is ORS, things like that. So if you've heard one of those acronyms before, that is actually referring to your state PDMP. Again, I added a visual of the information that has both the PDMP and the ePCS requirements on it. So you can find your state and determine, what's required at this point, see if there's any pending legislation, but really eyes out for next year, for 2021, since there are a lot of effective dates coming. Lastly, again, I promise I will be quick, but I wanted to look at ePrescribing under MIPS. ePrescribing has been a staple measure under the Quality Payment Program, or MIPS, and also Medicaid on the other side of the house, Medicaid PI, since it began in 2017. And prior to MIPS, ePrescribing was also a staple in the Meaningful Use Program from the very beginning. So currently, this measure falls under the Promoting Interoperability category of the MIPS program. Now, although the bare minimum required to earn credit for this measure is to ePrescribe at least one prescription, eligible clinicians can actually earn up to 10 points towards that category score, depending on what percentage of prescriptions they actually do ePrescribe. So example, if you ePrescribed 900 out of 1,000 of your prescriptions, you would earn 9 out of 10 points for this measure. The denominator for ePrescribing encompasses the total number of prescriptions written for drugs requiring a prescription during the performance period. So that's a common question I get. It's not tied to the patient or an encounter. It is truly the number of prescriptions. And it's important to note, and I know it's often overlooked, and I know Lexi mentioned this earlier as well, that prescribed elsewhere checkbox, if that's checked within NextGen, then that particular medication will not be included in the denominator. So it won't be counted against you. And clinicians can actually choose to either include or exclude controlled substances from their denominator. There are actually two measures available in the HQM to track those numbers for ePrescribing, one that includes controlled substances and one that excludes that. You can pick whichever one you want to report on, and there's no benefit to a particular one. They're the exact same in CMS's eyes. So there are a few things for this measure that do need to be set up, and they were mentioned earlier in the webinar, but you do need to enable eligibility checks and verify they're enabled for each provider. You can go into File Maintenance, that provider master file on that ePrescribe tab, and you want to ensure that medication history and eligibility are selected in that mail order service section. In System Admin, you need to enable one of the following settings, either perform eligibility upon new encounter or upon opening medications. You also need to make sure that your formularies are installed for the entire reporting period and are being used. And then lastly, it's recommended that in NextGen EHR, if we want to click this guide, it should be another pop-up to come up. If you go to Tools and then Preferences and click the Formulary tab, there's a checkbox that you need to check, and it says Use Formulary as Default Medication Search. Again, so these are all just best practices for that ePrescribe measure under MIPS. Another measure under MIPS PI is that PDMP, which we just talked about. This was added in 2019, and it's an optional measure that can earn you bonus points. And fun fact, for next year, it's actually proposed to earn you 5 more bonus points from 5 to 10. So basically, it just means for at least one of those Schedule II opioid electronically prescribed that you actually use a PDMP to query that. Now, in order to ensure this measure is completed successfully, we need to do the following in NextGen. You have registration with the ePrescribe Gateway. If applicable in state, I did put that in italics. There are some states that this still is not available for. Just some information on ePrescribe, there is possibly a provider license fee, and any eligible clinician in a state that's not covered by this will need to register with their state. So a question I get a lot, you don't have to use ePrescribe through NextGen to earn credit for this. You can actually go outside of NextGen and use your state PDMP that I referenced earlier to get credit as well. And when it comes time for submission, this is just a yes attestation measure, and you just want to keep a screenshot for your audit binder in case CMS ever does come back for an audit. Now, there is some setup involved, and keep in mind when we look at this slide, we're talking about PDMP, about that PDMP gateway as if it's already enabled for your practice. If it's not, or you have any questions on this, there is a really great setup guide on the Success community, which we provided a link to. There has been a relatively new change, but now you need to actually have the role of physician in order to request this PDMP feedback report. This has caused some issues since it didn't start like this, but this does require some configuration in system admin and in file maintenance. So we left those kind of breadcrumbs up here for you to look at and to reference. One thing I want to note here in that file maintenance master list and that PDMP gateway role, you cannot hide the physician role. And if you add or modify a gateway role that's not included in that list originally provided, the PDMP report request for that role may fail. Once all the setup is complete and the clinician has successfully registered, a PDMP link will appear in your medication module within NextGen. So to check the PDMP before ePrescribing, just select the link and a check will run on that patient. All right, well, that is it for today's presentation. If you are uncertain where your practice stands, go ahead and let us know. We can help. We can assess your current practice state and provide recommendations and help you implement any new processes or procedures surrounding ePrescribing, but really anything NextGen related as well. Feel free to visit our website, continue to sign up for our webinars, and consider some of the services we offer, such as our on-site consultations for EHR, PM, and technology, as well as test drive our products. All right, well, we have barely made it, but it is time for questions. So Chelsea, I will turn it over to you and keep our contact information up on the screen for those that are still on.
Perfect, thank you so much. And wow, that timing was close. We're gonna go through all the questions we have, so we might run over a few minutes, but we totally understand if you need to duck off. Like I said, I'll be sending out a link to the recordings and slides within the next few days here, so you can always catch up what you might have missed if you have to leave, when it's over. Okay, so first question, Lexi, I think you covered this. You showed us how to set up the providers in ePCS, right?
Yes, that was that second piece of the configuration. So like I said, those slides will go out if you do have questions about those steps.
Perfect, thank you. Next question. When you are sending multiple scripts to different sources, can you select 2 commercial pharmacies or must it be 2 different, such as mail order and commercial?
You can select 2 retail or to mail order or a combination. So yeah, it's just different destinations. That was just one example I gave. But yes, they can both be 2 commercial.
Awesome, thank you. Next question. What is the recommended procedure when a provider moves from one employer to another, but they were using SureScripts on the prior employer and will be using it again with the new employer?
So you can actually submit to change that registration and enroll them through SureScripts with your practice. I do know that that's something that can be kind of tricky to make sure, but you do want to make sure that they are unenrolled. So that's either something that their previous practice can do through that, their system, or that's something you can also reach out to SureScripts for help with.
Perfect, thank you. Next question. Currently in our paper-controlled substance world, we can prescribe 3 months of medication at a time. We frequently do this for ADHD medication. Can this be done electronically?
I would say I know with a lot of e-prescribing rules that they are by state. You know, there's different regulations, so I don't want to say for sure, but they're depending on your state, you should be able to e-prescribe controlled substances in the same way you would do on paper. It's basically just taking that process, off paper and making it electronic. But again, I would just say, as far as the legality of that, you would want to research, the individual laws for that.
Perfect, thank you. Next question, it looks like this might be our last. So if you have questions, like I said, we'll stick around and answer them. So now is a great time to type them in. For a mid-level provider, they can't prescribe controlled substances. So providing supervising provider, does that allow to have mid-levels, does that allow mid-level providers the ability to send controlled substances?
So no, you're correct that mid-levels can't provide or prescribe, controlled substances. So I believe you're referring to that mid-level supervising physician checkbox on the ePrescribing tab, and that would just be referring to ePrescribing non-controlled substances. So yeah, those regulations still have not changed.
Thanks for asking for that clarification. That was a good question. Another question. It is important to note that the phone tokens for ePCS and System Admin will need to be updated as the providers get a new phone. Systematic will not have the same credential ID on a new phone. Thank you. That's a great reminder. Lexi, do you have anything to add to any of this while we're waiting to see if there's any more questions?
No, but yeah, that is a great point. Yeah, a lot of those tokens, as you mentioned, it is tied, unfortunately, to that physical phone, not just like a phone number. So that is a great point. Yeah, I would definitely, if you ever have any questions like that, make sure to double check with your vendor, just because they all work a little bit differently. But yes, that is correct. With Symantec, you will have to, re-register and make sure that provider's set up if they got a new phone. Great point.
Easy to overlook in the hustle and bustle of changing phones. Also, similarly, if they get a new computer and you're using the computer for tokens, basically anytime you change your technology, take note of what you might need to update for those tokens.
Yeah, that's a great point as well.
Okay, well, it looks like that's it. But like I said, I'll be sending out these slides and recordings in a few days here. So if you think of questions in the meantime, you see Lindsay's and Lexi's information up on the screen. You can always reach out to them directly. You can also always reply back to my email when I send them. Any way you can get a hold of us, we're happy to answer your questions and happy to help. So don't hesitate. And we got another tip. We have to be sure to delete old credentials. Sometimes that causes problems if too many in System Admin.
Yeah, that's a great point. Yeah, you want to make sure that information is up to date, and as well with updating. Again, if a phone number or anything like that changes for the provider, that's another thing you want to make sure you're updating that enrollment with short scripts. So basically, any kind of change, just make sure that you're updating your enrollment
and removing the old ones too, keeping your system clean. Okay, well, thank you, everybody. Lexi, Lindsay, thank you for the info. Thank you, everybody, for joining us. And we look forward to seeing you hopefully next week's.
Thank you, everyone.